Welcome, hopefully you're in the right room where you came meant to be. So this is a session on where we want to talk about understanding when your water's on, about measurements of intermittency and predictability in piped water supplies. My name is Emily Kumpel. I'm an associate professor in civil and environmental engineering at the University of Massachusetts in Amherst. And we have a large team here that we're all been working on these topics and wanted to bring people together and start this conversation. And we're hoping this will be more of a conversation. I'll let people maybe introduce themselves as they come up and talk. But to also introduce the others from UMass who are here because they'll be helping with the breakout session later. There's Dr. Karina Chavaria and Poonam Tajapuri and Gabriel Masole. So they'll be helping with the session, the breakout rooms that we'll do a little later. So the clicker was working, but apparently now it's not. So there we go. All right. So just so you know what we're planning for today, we're going to start with an introduction about intermittent water supply and its complexity. Maybe you're familiar with this and have worked on this. Maybe you're brand new. We want to bring everyone up to the same page of what are we talking about? Why are we talking about this? And then we're going to go through with everyone else here about some ideas of metrics, indicators, and questions used to quantify intermittent supply or supply interruptions, and why these are necessary from the perspective of utilities and water suppliers, and then from the perspective of households. And then we don't want to talk at you the whole time, so we want to do breakout groups. So we're going to form groups. If you are joining us online, we do have a way to do this with online breakout groups as well, and some instructions, and we have Poonam who is managing that, so if you have questions for her along the way, you can do so. So we'll break out, and we have some example survey questions and metrics and indicators that all of us have used before in our studies, and as you'll note, they're all going to be different, and so we want to have you talk about maybe which ones might be good to use, have you used them, and why, and get your feedback on that, and we'll reconvene as a large group. So we're talking about piped water supply, intermittent water supply. You can also say, rainwater system is an intermittent supply. It rains periodically and you store it. But what we're focusing on for this session is piped water supply that is intermittent. So access to piped water is increasing all around the world. Governments are investing in piped networks. But the presence of a pipe doesn't necessarily inform the quality, quantity, or the frequency of delivery. And as a reminder, for a source to count as safely managed, one of the key metrics is it must be available when needed. Mm-hmm. And so there's several different ways you can get at that. But one is trying to push ones that might be intermittent or not available continuously towards more continuously available. People will talk about can also use storage and household storage in order to make that available when needed. So intermittent water supply, the International Water Association defines IWS systems as piped water supply service that's available to consumers less than 24 hours per day. That's the official definition. What does that mean? How often? Is that every day? Is that sometimes? That's what we want to talk about today. But there's many other words for this, and you might have heard some of these words in different places. Sometimes this is called rationing. You might hear about a water rationing schedule. You might hear about water shortages, unreliable supply, discontinuity, interruptions, supply-driven supply. All of these are words that are used in many different places in order to talk about a very similar concept, which is water when pipes do not provide water 24 hours a day, 7 days a week. You can often know that there's intermittent supply when you look around and you see roof tanks everywhere. That's usually a good sign that there's, not always, but that is often a good sign that there's an intermittent supply. Or if you see valve operators in the street turning on and off valves. Those are things, if you visited different cities, you might not have noticed there was an intermittent supply because maybe where you were staying had a roof tank, and so it felt like a continuous supply. But these are some of the signs that might show that. Getting good data on this is really hard. Again, this is why we're talking about this. The estimates that have been done have estimated that at least 1 billion people in the world have intermittent water supply. This is a huge percentage of the people's population, right, of the world. It's 1 billion. So there are some estimates about how many people might be affected on every continent. But also to point out, this one was the previous map showed the population in terms of in millions of people that have intermittent piped water supply. This one I made before, and it is, you can notice it's very incomplete. This is trying to get at the hours of supply that were actually being provided. So you can see some places regularly have less than 10 hours of supply per day. But the data are, we'll talk about this, are very incomplete, just missing and not always, definitely not standardized in how they're actually collected. So with an intermittent supply, it can take many different forms. You can kind of have this spectrum of what might be called mostly continuous to mostly intermittent. And then you can have some that might be predictable and some that might be unpredictable. So there might be a water supply where water is provided to the whole network for 2 hours every day. Often I'll do this interactive, but it's a little hard to do this. But if I teach this in class, I'll say, okay, where are we going to put this? So I'm just going to put it here, and hopefully you agree with me, but if not, please tell me. That water, for example, if it's provided to a whole network for 2 hours every day, we might call that mostly intermittent, right? 2 hours out of 24 is not that many, but it's every day, and you know it's going to happen every day. We might call that pretty predictable. Hopefully you agree. Maybe? Yes. But let's say there's another city where it's 24/7 supply, except high elevations lose pressure sometimes. All right, mostly 24/7, so I'll push that to the mostly continuous side, but some areas lose pressure sometimes, right? So that might be unpredictable in the outages. Some agreement, maybe? But what about if we have rotational delivery, where different parts of a city or town receive 5 hours every 3 to 5 days of supply, and that's often late, might be early, might be skipped entirely. Mostly intermittent, right? 5 hours every 3 to 5 days, not many hours. And you don't really know when exactly it's coming, right? So we put that in that unpredictable. Or what about you have a city with 18 hours of supply, and the water is turned off at night to minimize night flow leakages. Might call it more on the continuous side, right? But pretty predictable. You know, at 10 p.m. you're going to not have water in the pipes, and then you turn it on at 5 a.m. or whatever time. Then we start to get even more complicated. Let's say 90% of the city gets water 24/7, 24 hours a day, 7 days a week. But there were some areas of the city that had gotten some earthquake damage some years ago, and they only get water supply every 2 days. But now we need to characterize the whole city, right? So some people are getting 24/7, and some people are getting it every few days. So we might say, okay, it's somewhat predictable, more on the continuous side. Where does that lie? Are we talking about individual households? Are we talking about the whole city? All of these actually are very real examples that all of us here have worked with of different types of intermittent supply, from Panama to India to Mexico to Uganda to, anyway, these are the particular examples, but you can map out many different intermittent supplies. But it does get complex when you're talking about really large cities and towns, and when the areas, different people might experience different things in the same network. So just to talk about this, you can have a city or town that has maybe everyone gets water for a few hours a day, turns on and off for, say, an entire small village. That would be one example. But often when you start to get bigger, you get rotational delivery. And this gets super complicated. You have all of these different areas where maybe you need to turn on a main line from a hydraulic standpoint. This main line needs to go on for 12 hours, let's say. And then, so if you happen to be along that line, you get 12 hours of supply. But then if you are on some of the feeder lines off of that, then you might just get 5 hours of supply, because that 12 hours has to stay on, because it's going to supply the next areas. So you might have 5 hours of supply for this area, but then later you turn on the smaller feeder line from that, because water flows through pipes, right? So you might only turn that one on for 3 hours at a time. So you can have people in a small area that are experiencing very different number of hours of supply just because of the hydraulics of how water has to run through pipes. And then that 12-hour supply, maybe the other ones turn off, and then another one turns on for 4 hours. It's really complicated. And then you can also say, all right, that's what the utility supplies. They're like, yes, we supplied 5 hours of supply here, but what do households actually experience? So this household that might be at the beginning of the network might get their 12 hours of supply at 20 PSI pressure. It can go right up to their roof tank. That's pretty good, right? But if you're at the end of the network, all the other people are using the water ahead of you, the pressure is going to drop by the time the water supply gets to the end. So maybe you only have 5 psi of pressure and you're only getting 3 hours, right? And so you can have a whole lot of variability within the same network just because of how the hydraulics and how this rotation actually works. And then to further complicate things, households can basically simulate a continuous supply. They can make an intermittent supply, a continuous supply with their coping infrastructure. They have storage infrastructure, public and private water sources, trucked water, other things that kind of mediate this. So especially the higher income households are going to be able to simulate a continuous water supply through extensive storage and alternative sources, even if the water is intermittent. So we've been, and by we, many of the people that are here, and particularly I'll call it Justin Stoller for this, is we've been talking about what are definitions around this, because we use words like intermittency and interruption and disruption and continuity. Everyone in the sector and policy and practitioner and research, we're using these words differently. And so we've started to try to come up with some definitions of these things. Where intermittency or discontinuity from a service provider perspective might be a lack of continuous availability in the system, but for households or the water users, it might be answered differently if the household is planned for this, right? If a household has a huge storage tank and the water gets delivered once a day and they've stored this water, they might not experience that intermittency, even though the supply is intermittent. So you can have the same definition that's experienced differently, whether it's a utility or a household. An interruption, what is it? When does intermittency become interruption? That's a really good question. We don't know. That's something we need to talk about. But interruption is maybe water that's not available in the system or infrastructure as expected. We can also think about this, a joint monitoring program definition of available when needed, but that might also, again, depend on household wealth and infrastructure. We can talk about unpredictability, right? We mapped out this predictable or unpredictable supply. So do we know about the supply in advance? Does a service provider have a predictable schedule where they provide this many hours here, this many? And then do users actually know when that's going to happen and how often? And then reliability, so a likelihood that a water system will fail or not fail, and what does failure mean? Provide water as expected, whether that be availability, continuity over a time span. So we're still working on some of these definitions. This is a work in progress, so stay tuned for a paper in the coming months that will actually try to lay some of this out. But we wanted to see and get your feedback on some of this. So we would love, when we get into breakout groups and such, to and if you want to continue this conversation, to have that conversation. So next I'm going to hand it over to some colleagues to talk about some of the indicators that are currently used in the sector, or that we have all used, and some of why we might want that. So we're going to first do utility and 2 examples of utilities, and then we'll move on to households.
Hi. My name is Stephen Meyer, and I'm an assistant professor at the University of Toronto. And I want to give you a sense of what it might look like if you went to try and ask a utility, how intermittent is your system? You might hope to find an annual report or a website with excellent documentation. And fundamentally, you'll find a table, if you get lucky, that says something like the utility will attempt to provide water according to this schedule. They'll have a zone that's like a reservoir. They'll have a pocket or an area or a descriptor near the post office, and a supply timing. If it's a schedule, if it's a city that publishes a schedule, right? So you have to have some degree of meaningfulness of a schedule for it to be worth it to be on your website. But if that's true, you could imagine one neighborhood, Main Street, getting 9 to 11 a.m., and then 1st and 2nd Street getting both 9 to 10 a.m. and 4 p.m. to midnight. Some areas could get it with different days of supplies. You might find a row in your schedule that says daily, or a row in your schedule that says Tuesdays and Fridays. You might also find a city that doesn't have a constant schedule, but has a rolling schedule. So instead of days of supply, it might say date of supply. So that's the neighborhood that's on October 15th or 14th, Main Street gets water, and on October 6th Street, 1st and 2nd Street get water. This is harder to process because you have to stitch it together based on the column that is least reliable and has the most typos, the street name column. You can imagine all sorts of different schedules. So here are pictures of what actual schedules look like, cropped so you can see them, but you have Lots of things, 5 a.m. to 7:30 a.m. on every third day. Does that mean 2 days of gap or 3 days of gap? I'm not sure. You can also imagine morning timings and evening timings. So from 3:30 a.m. to 8 a.m. on Tuesdays and Saturday, daily, Monday, Wednesday, Friday, and daily, right? This is 5 rows taken from a schedule with more than 2,000 rows. And we got Tuesday, Saturday, daily, Monday, Wednesday, Friday, daily, daily, right next to each other. So they are quite complicated, but these are the least complicated forms of utility schedules because they're static. Right? They have days of the week with hours that are reasonable. But you can also find rows in these schedules that say things like the availability of water, this is a quote, is 19 to 20 hours per day, divided in each pocket for 60 to 90 minutes every 2 days. And then they have a list of 27 different pockets, and so it's a rotational supply. So, like Emily described, the whole system gets 19 hours of supply, but one at a time your neighborhoods roll down the street with your valve operator on his motorcycle or his bicycle, turning them on and off. So towards metrics, I'll talk you through the easiest metrics. Supply duration. Hours the water is turned on when it is turned on. So from 3 p.m. to 6:30 p.m. is a duration of 3.5 hours. This one is really easy to understand, but sometimes people say duration when they mean supply continuity. So hold that in mind. We can have frequency, so you could imagine a supply on Mondays and Tuesdays. I care a lot about supply frequency because it tells you about the supply gap, which tells you how much storage people need. So 2 days a week tells you something about the supply, but knowing the days of the week tells you that actually Sunday and Tuesday is a terrible spacing. You could do Sunday and Wednesday and need 1 day less storage. Right, so we care about frequency or timing because of the supply gap, and we multiply frequency and duration to get the average amount of water you get, and that's supply continuity. The average hours per day of supply. So sometimes you'll read a paper and it'll say the city was on, like this is a city that runs with a supply duration of 1 hour. Incorrect units. Is that 1 hour when it's turned on once a month, or is that an average of 1 hour per day? Really hard, really important. So similarly, frequency matters because you can have the same duration, but once a week means a different supply gap, so you now need more storage, and half the continuity, right? You get an average of how much water you can fill in 30 minutes of whatever pressure you have. And again, at once a week, you could have a longer duration. 7-hour duration once a week gives you a similar supply gap, but the continuity of your first system. So you now get back to this 1 hour per day on average, which gives you more water you could take out, provided you have the storage. So these, I think, are the 3 biggest and most important metrics that I have been working with when I think about water utility schedules. And they're relatively straightforward if a utility runs with a constant schedule that is uniform across the city. But these are averages. They average time and space. And that becomes much trickier to figure out what you want to do with if you want to assess how things are changing over time. So here's a plot of 16 months of data, supply continuity, hours per day on average. As we go through some seasonal changes, both on average and in the best quintile and the worst quintile in a city. You can imagine doing a spatial analysis of a different city where you think about wealth by neighborhood and hours of storage required by neighborhood. And you could look at an inequity plot where in this particular city, the poorest households who have the least money to buy storage, the least structural integrity to support kilograms or tons of water on their roof, require the most storage. So that is not just a city that is inequitable or unequal, it is a city that is inequitable. So I think a lot about these 3 metrics and how they vary spatially, temporally, and I especially think we need to be thinking about dispersion so that we can think about equality.
Wow, thanks. Some hard acts to follow. Thanks, everyone. I'm Rachel Pellis. I'm the Executive Director of the Aquaya Institute. And I actually just wanted to start from kind of more of a personal experience and ask who in this room has experienced intermittent water supply, or not when they want it on. So yeah, thanks. And just wanted to kind of bring it back to the reality. These are 2 examples of places that I have worked and cities where I have lived. Lusaka here on the left, this is the biggest hospital in Lusaka, University Teaching Hospital, UTH, where I was for 2 years during my PhD. The water was not running a lot of the time. And this was not a predictable schedule by any means. This was like, oh, guess what, there's no water right now. And I fortunately was not the one that was dealing with the patients, and so as you can imagine, this was a really serious health concern. Second one on the right, who in the audience recognizes this building? My wonderful Aquaya colleagues. This is the Aquaya office in Nairobi, which generally, we do have good storage, generally has pretty good water, but we have had months where we had issues with water supply. So obviously creates sanitation and other challenges. So just wanted to bring it back to the reality. Why do we care about intermittent water supply? I started asking our colleagues about this over the last few weeks, and it touches almost every research project that we have going on. And this is by no means an inclusive list of everything that we're doing, but just kind of a subset of what we're doing. We're doing a lot of work on water quality testing at Aquaya. Guess what? You need to know when the water is running so that you can know when to do the testing. So we are looking at what are the most cost-effective water quality monitoring models. Where do you test water? Under Real Water, we're working on a water quality assurance fund. And we've also published on centralized or decentralized testing models and what makes sense in what context. But this really depends on when the water is running. And we've found one of the inefficiencies is that crews will go out to sample and there's no water. So who's going to pay for it then? So that's one area where we really found this is important. Another area where we have worked is on cross subsidies for sanitation on water bills. So this idea, if you add a sanitation surcharge onto water bills, are people willing to pay for that surcharge? And we were looking at, is intermittency associated with that? Are people willing to pay if they're not happy with their existing water service? Definitely an issue. Another study that my colleague Kara Stewart is leading on costs and benefits of on-premises connections, and she has a talk tomorrow afternoon on this, in looking at what are the costs and benefits of piped water connections at the home. But of course, this depends on how often the water is running, where the costs are of course less, but the benefits are less if that service isn't provided frequently. Water safety plans, looking at do they impact intermittency and reliability. Another project that we're doing is performance-based funding in Ghana. So how does intermittency compare in rural small pipe systems, looking at as we're trying to see who should be eligible for performance-based funding. And for that, we want to do benchmarking and understand where are systems to start. So I just have one last slide, and this is just an example of that specific project that we're doing in Ghana and some of the indicators that we're asking about. When is water supplied? So this is one example from one rural water provider in Ghana, and I could have picked a whole bunch, and there's a huge variety, but some of these are on set schedules. This is generally most of the day if there's electricity. But then there's this so that's when it's supplied to hand pipes. Then there's also this distribution aspect. So when is the tap actually on? So it's a subset of that time. And then of course not on market days as well. So there's that. But then we also ask, okay, but in the last 3 months, how many days experienced service interruptions due to technical challenges? So now we're looking at that measure of predictability and when are the days that maybe aren't going with this predictable schedule? So on average, 5 days, and how long did those last? On average, five days each time. So over the last 3 months, that would be 5 days, 5 times. So that's, 5 and 5. Sorry. But so there's 5 days of each interruption, and sorry, I'm getting lost on my slide. But anyway, so there are like different metrics that we're looking at for these different supply systems. So just wanted to end there, and and another thing, maybe just one last note to kind of transition onto the household aspect, is we also see big differences between households and utilities. We have had other studies where we ask the utility, when is your water on? They say, oh, we supply 24/7. And then we go to the household and they say, oh, that is not actually the case. We only get it on these days. So with that, I'll pass over to Aisha. Thanks.
Thank you, Rachel. Hi, everybody. My name is Aisha Arjman. I'm an associate professor in the Global Wash Cluster at North Carolina State University, and I'm going to take us over into the household space of intermittent water supply. And that's everything that I just said. So, and specifically, I'm going to talk about an impact evaluation that Emily and I actually, like a little while ago, conducted in India, specifically focused on intermittent water supply. I'm going to be using the words IWS for that throughout the presentation. So when we embarked on this, I'd say a little over 10 years ago, there was no major Indian city that had a continuous water supply, and I've checked, and that still appears to be the case. Correct me if I'm wrong, but it still appears that there's no major city actually gets their water in the way Indians like to call it, 24/7, 24 hours a day, 7 days a week. There are, however, efforts to put that in place in multiple cities throughout India and elsewhere globally. And at the time when we embarked on it, this was a controversial undertaking. There was a lot of debate around people are used to a certain way of storing their water. When the new water comes, they dump what they got. Like if they now all of a sudden have continuous water, are they going to waste a lot of water, right? There was just a lot of talk on the street about what this might do. And there was an inkling about what it might cost to upgrade a whole city from an intermittent to continuous system. There just was not a whole lot of quantified data on what the benefits may be, or how large are the benefits, is that going to justify the cost? So that's kind of what motivated us to do our impact evaluation. And we were lucky to just really be able to piggyback on a demonstration pilot project that was really trying out this continuous supply idea in a city in the twin cities of Hubli Dharwad in the state of Karnataka in India. And luckily for us, what they did was before they committed to doing this everywhere, they were like, let's just try and convert 10% of the connections in the city to continuous water supply. The remaining 90% stay on their intermittent supply, business as usual, and then we're just sort of gonna see where the cards fall out. So that, as a scientist, gave us a perfect platform for being able to do an impact evaluation. It's like I'm an epidemiologist, right? If I was gonna design a study to study this, I'd be like, well, some of you folks, just get upgraded to continuous, some of you stay in intermittent, we're gonna go ahead and compare. Very hard to do on a scale like this, but we're fortunate to be able to leverage an ongoing sort of natural experiment. So we ran a matched cohort study, which in epi language, right, it just means we're looking for folks who had remained on their intermittent supply, who looked as similar as possible to the demo guys who'd gotten continuous supply. They were just identical in every other characteristic, except that, right, externally, the water supply frequency had been altered in one of the groups. And we were curious on understanding impacts on water quality. I mean, this is at the time quite groundbreaking. Like, I don't think it had quite been done. How is this going to impact infectious disease, coping costs, or really across the board? And we did 4 rounds of household surveys with 4,000 households, 2,000 each scheme, right? The demo zones with the continuous supply and then the other group with intermittent. And we really wanted to visit them for sort of 4 times across the span of a year, because we anticipated some of these complexities. This is going to change seasonally. So if we just get one data point, like, we're probably not getting the full picture here. So what we did find was that it did pay off to change the operating of your pipes from intermittent to continuous. All sorts of metrics improved. Water quality was better. Taps were a lot more likely to provide E. coli-free water if they were running continuously, at about 1% positive for E. coli if you had continuous water, versus 32% in the intermittent scheme. Complication was folks continued to store, and by the time we sampled the stored water, some of that benefit had diminished, but you can still see it, right? The stored water, even stored water, was cleaner if it had been procured from a continuously supplied tap. And we also found reductions in infectious disease, so really compelling reductions in the incidence of typhoid fever, in sort of bloody, some more severe forms of diarrhea in children under the age of 5 years in low-income neighborhoods. And I'm going to try and bring this back to this idea of metrics, right? Because that's why we're here for this particular comparison. Luckily, our metric was simple. Do you live in a demo zone, right? Like, that's sort of like what would drove this particular comparison. And all of these analyses wrote in that binary, yes, I have some form of continuous water, or I don't. But we were curious, how continuous is continuous, right? Just because you said yes and you live in a demo zone, does it truly mean that water does come out for 24 hours out of your tap for 7 days a week? So we did ask. We asked about intermittencies in the continuous zones as well. And the way we phrased it, and that was just sort of like to the best of our brainstorming at that time, in the last month, how many times did you have intermittencies in your water service? And last time that happened, for how long was the water off. And we found that actually for half of the folks who lived in quote-unquote continuous zones, they had lost water service at least once during our study period. In some of the cases, it was a short intermittency, less than an hour, but some of them were right up to 24 hours, more than 24 hours, etc. So there's like sort of like shades of continuous within the folks who are getting continuous supply. And you might also imagine, like, if you live in a continuous zone, but things sometimes still shut off, and then it made a lot of sense that people would continue to store. So we did find that almost 80% of folks who were getting continuous water supply still continued to rely on storage containers for their immediate needs. If you asked them, can you give me a glass of water? They did not go to the tap, even though presumably the tap would have flown. But people went to a container that looked like this about 3/4 of the time, and they had been on this continuous scheme for several years at that point too. We also had an inkling that not all intermittent systems are created equal, so we also wanted to kind of just dig in a little bit how intermittent is intermittent. That's before we had heard from David about these 3 important metrics like duration, frequency, continuity, but I do think we stumbled upon fairly similar metrics, back in the day, and we asked, and again, right, we're like, well, recall is going to be really hard. If we ask how often does your water come, if it changes, well, this time it came every 3 days, but maybe 6 months ago, like it was a drought and it was different, and we're like, we got to hone in on the latest experience. Today is Monday. On what day did your water last come? Right, then we figured since we're going to go back to the households multiple times, we're just going to capture the inherent variability that way. And that was generated like a, sort of like a nice matrix of like gargle and like, just lots of names of the day and days of the week being mentioned that Emily somehow then made sense out of, and that we could convert to a supply frequency. And then we asked, when do you expect it to come again? And last time it came, how long was it on, right? So we're just kind of getting at these ideas of supply frequency and duration. But we also had an inkling that this might not always be predictable, so we did put in some predictability questions as well. Does it always come at the same hour? If not, how many hours do you usually wait for the water to come? In the last one, how many times did the water not come on the day you expected? And how many days later did the water finally come? So if you want to see, sort of, I gave a sneak preview of the yes and no binary demo zones, but if you want to learn more about these metrics and what they spell in terms of health outcomes and coping costs and things like that, we do have a presentation upcoming tomorrow by Poonam Tajanpure, and she's going to talk about specifically predictability, because we're learning from conversations with our colleagues. Justin Stoller has been leading a lot of work on this. This predictability aspect is not negligible. I did just, if you have some way of knowing that the water is going to be off, there's things you can do. So that's my little plug, and I'm just going to pass it on to Justin to just, no, I'm going to pass it on to David.
Yes. So David Fuente is at the University of South Carolina, and he's remote, but I don't think we figured out how to also be able to see him, so you're going to listen to him right now. I don't think you can see. So David, could you go ahead?
Yeah, can you hear me, Emily?
Yes.
Fantastic. Well, sorry for being the face behind the curtain, but just wanted to dive in here, and I think Justin's going to move into this to some extent next. But just something I wanted to pose for the group and hope you can make some progress on thinking about and discussing as you talk about metrics in particular. Was just the reasons why we might care about intermittent water supply. I think we're focused pretty sharply on how we measure it better and how we conceptualize it. But big picture, we're interested in the health impacts. Just talked about reductions in E. coli, both in tap water and stored water supply and actual health outcomes. We might also be concerned about stress and overall well-being. As an economist, I'm concerned about coping costs, so alternative supplies, in-home water treatment, times people spend dealing with intermittent water supply. But I think collectively, as a group, we haven't paid as much attention to the extent to which intermittent water supply influences customers' willingness to participate and how we finance kind of the larger infrastructure transition we face. I'm not sure they talked about it in today's session, but this is going to be extremely expensive, right? If we want to meet this ambition of providing safe and resilient infrastructure for all, we're going to have to mobilize all financial resources available. Unfortunately, there's just not enough government or donor funding to do it, right? There's not enough grants to finance this infrastructure transition. By and large, governments haven't been willing to fund water infrastructure out of general tax revenue. And although we often don't like to admit it, like all finance, including innovative finance, is really underpinned by customer revenues, right? People actually paying their water bills at prices that cover the cost of service. So for me, I'm interested in, if you look kind of here on the left-hand side of this vicious cycle that many utilities are in, I think IWS is a symptom of a badly performing utility. So that's in the upper right there at the left. And I'm interested in, I think we should all be interested in, the extent to which the transition to better quality services affects customers' willingness to pay, um, their resistance to tariff reform or increases, and eventually kind of how that allows us to leverage more finance into the sector. And I think there's different parts of it, right? To what extent does intermittent water supply undermine trust in the service provider and government more broadly? How does it affect people's perceptions of what a fair or reasonable price is? That's conceptually different than willingness to pay, but I think we should pay attention to that as well. Willingness to pay at existing prices. And then the uncomfortable truth that prices are going to have to rise considerably if we're actually going to do this in a sustainable way. So to what extent does intermittent water supply affect people's willingness to really roll up their sleeves and chip in? Second question, just to put on the table, and this gets to the intermittency and predictability piece that was brought up, is, I'd like to know what attributes of service customers value the most. Is it just blunt more hours of supply regardless of when it comes? Is it reducing that supply gap that Dave talked about so they could have less storage on hand? Or is this really a story about reliability and predictability in terms of what customers value? So just wanted to throw that out there for you guys to consider in the room. Thanks.
Hi, everybody. I'll pick up there. I'm Justin Stoller. I'm a professor of geography and sustainable development and public health at the University of Miami, where, by the way, the storms didn't come anywhere close to us. It rained every day last week, except when the storms came by. But I highlight the department I'm in because actually the 6 of us, including other David that you just heard from, are trained in 4 or 5 different formative areas, yet we're all doing this work together, right? And I think that those different perspectives are super important. And so I'll bring us back to big picture. Why do we care about all of this, right? Besides being able to raise financing and mobilize resources to the types of solutions that we want to see, right? It's also about the broad health effects, right? And David kind of introduced some of those, right? It's not just all the diarrheal diseases and infections that Aisha has studied in detail, but mental health, psychosocial effects, right? When everyone raised their hand that they've experienced intermittent water, you probably remember how annoying that was, right? But we also all probably had pretty easy ways to adapt to that, but we know that not everybody does, right? Besides that, and there's so many other health effects, right? The risk of vector-borne diseases from improperly stored water, all the other things that we know about, right? And then there's also very well documented costs related to disruptions to people's livelihoods, pulling kids out of school, interference with building social capital when neighbors are essentially competing for limited available water in a neighborhood and potentially even experiencing conflict over it, conflict within households, and all those other costs related to adaptation strategies that, again, we've all seen. Of course, there are significant equity and justice issues, right, that pose limitations on people's ability to thrive in their communities. And we haven't talked about, but if you have an engineering background, you know about this, that intermittent supplies also create a lot of wear and tear on the utility infrastructure itself. And so even if it's a little bit cheaper to run those types of to run those types of water systems in the short term, in the long term, right, there's a lot of stress on the pipes, on the valves, and so forth, and it really shortens the life of the utility itself, of the infrastructure itself. So pulling all these things together, right, we theorize, and again, many of you have experienced this, that these interruptions are most severe when service is unreliable or unpredictable. And we tested this in a study that we published, several of us co-authored this, came out earlier this year, where we pulled data from 10 sites across 9 countries and looked at this causal or conceptual diagram here, where water source intermittency, regardless of whether it's predictable or unpredictable, right, can buffer and exacerbate different forms of water insecurity, which include these psychosocial elements, right? And we constructed these psychometric scales representing emotional distress and stressful behaviors, and we saw that predictability actually mitigated the effects of interruptions on emotional distress and stressful behaviors. You can see the numbers here by 25% and 50%, right? What a big difference, right? This is why, David mentioned on the last slide, right? Is it really about more hours of service, or can we just make that service a little more civilized? People know when to expect it and they know how to adapt, and again, they can rely on that. All right, so again, big picture, all the things that you've heard today kind of bring us back to some bigger research questions, right? The biggest of which is, hey, in a century of climate disruption and infrastructure that's just wearing out all over the world, and infrastructure that we just aren't going to be able to put into the ground to give everybody 24/7 water all over the world. If we're realists about this, right, is this a feature or not a bug of the upcoming century? I know that's an uncomfortable thing to talk about. Are we prepared for these types of intermittent futures? What do they mean? What does unreliable really mean in different contexts, as Emily introduced at the beginning of the session here? And what is the evidence base? We're realizing that the more we dig into this, there's so much more that we don't know about how these phenomena vary around the world and so forth. And we actually need to generate a lot of new evidence before we're able to make those types of policy recommendations. And that's why we're all here to talk about this together today. So.
Great, thank you. So we're at 45 minutes, and from my experience teaching, that's when you don't want to listen anymore. We want to be engaging and talking. So we're going to do some breakout groups. If you have a device that you can use for bringing up some questions, there's a QR code, or we tried to make it easy, tinyurl.com/measureiws. We do have a few physical copies if you don't have a device that we can also hand out, but figured you might want access after and you're going to lose papers, so having this after is great. And then we're going to form some small groups and ask you to do a few things. So first we're going to focus on households, and in that sheet that we either can hand out or that you might have, page 1 is where we've compiled a whole bunch of different questions that either we've asked or that have come from other used survey tools. On the first page of how we actually tried to talk about or ask households for their experience with intermittency, households or schools, hospitals, basically anyone that might be receiving the water from their experience. On the other side is actually utility questions and benchmarks. We're going to first do households. And we're going to ask you first to go around your group, explain either where you live or work or have worked, doesn't have to be now, about and where you might have interacted with intermittency. I'm glad Rachel did the show of hands. Many of you have experienced this before, so think about a place that either you've experienced or somewhere that you engage with now that has experienced intermittency, and why, and talk about that, and what that looked like. How do you define that? And why might collecting that sort of data be important, whether this is for your research, for your job, for your community, whatever it might be. And we'll ask you to feel like the questions that we are on this sheet, these examples, capture some of the important parts. And then to talk as a group, so go around the group, and we'll remind you what the instructions are, and it's hard to remember. Go around the group, explain your experience with intermittency and why this might be important. And then to work together to say, if you had to come up with just a few questions, top 2 questions for households to characterize intermittency, what would you choose? Either from our list or come up with your own. Maybe our list is not great. Maybe you have your own questions. What would you ask? So to form groups, I think I would like for you all to try to self-organize into groups of 5 people. If you are standing next to colleagues or people you know, maybe just go across the room from them so you meet some new people. It's a nice time to meet people. And then maybe we'll do like 1 group here, 2 along the wall there, and then 1 in each corner, sort of 1, 2, 3, 4, 5. I think we should have about 25-ish people in the room, so probably about 5 groups should do it. And then we'll also bring around some paper for you to be able to write some things when you get to the second part. Any questions? If you're joining on Zoom, we actually will do a breakout room, right? Is that gonna work? Maybe, we're gonna try to put you in a breakout room, and Poonam will send out the chat and the instructions, so you can do it there. At the top of this link is a form to be able to give feedback, so if you are virtual and wanna give some feedback and ideas, there's a way to do that through that. So, please go find 4 other people that you haven't met before and form a group, and we'll just go around and assign people if it's not working. Okay.
and how when there is an intermittent water supply, people might switch sources and then they're being exposed to other risks as well as associated with that. That then ties into the second point that we had, which is how can risk, like the idea of like microbial risk, also be interpreted with intermittent water supply? And so trying to think of like how to expand upon these questions to better get at what risks people might have, what health risks are associated with this too. And the last thing we talked about is just the role that sensors might play. I think we talked a lot about like varying experiences with sensors, both good and bad, and like what level of data granularity that you get as part of that might not be captured like in a cross-sectional survey.
Great, thank you. All right, our Tuesday morning group.
Hello, we took quite a few notes. So for our household section, we thought it was important to discuss the location in the system, like if that's closer to the head or closer to the tail, because again, as we were talking about, that'll affect the pressure and kind of like how much water delivery you're getting. We also discussed the cast and the power dynamics. So like how could maybe some people could tap more, they could have like multiple taps in their house that might not be accounted for versus people who are kind of lower in the system might not have as many taps or as many sources. And then for the utilities, we thought it was important to clarify the actual versus the planned level of service. So is what is being promised by the utilities actually occurring? Is that actually getting delivered to customers?
Great, thank you. All right, our next group in the back.
The thing about that we need more, we can't in priority go in there. And Sarah, we talked about, there's some important perspectives that we should share next, but just maybe one thing that I didn't hear yet is, I'm an engineer, there's many engineers in this group, and we're thinking like, where are we headed and what benchmarks matter? Like, is there a ladder of sorts that we can move towards? And then I was just thinking of my training as a PhD student, where I was always encouraged to sort of approach, especially survey science, but just, the world from a very tabula rasa standpoint, like see it for what it is, build theory, maybe, question your assumptions or try to ignore them altogether. And so I kind of tried to put that hat on, looking at your measures without presupposing what matters most, in terms of outcomes or drivers. So hopefully that makes sense. The idea, I think, is that all of these measures ought to be investigated, and hopefully then a theory built around what is their large variation around, how does that variation explain certain, technological or social outcomes. So that was just one thought, but I feel, okay. We have some very interesting, first-hand experience also with intermittency in our group. And it's just interesting to reflect on how it's affected you personally as well.
Thank you.
Sorry to interrupt. Did you mean send the virtual audience to breakout rooms?
No, we didn't.
Okay. Yeah, can we close that and get us back in?
Oh, we didn't end up doing that.
You didn't do it? Okay. All right. Okay.
And then the other back group?
Okay.
Yeah.
So we had a lively conversation, but didn't take many notes. One of the things that we kept on going back to was the importance in doing any of this data collection with these questions of establishing a common definition with whoever you are collecting data from. Most notably, the idea of water being available from a tap, which is what a lot of these say. If you have a tap in your home that is connected to one of your personal water storage units, you may have water coming from your tap, but not necessarily being supplied to your water storage. Whereas if you are in an area where you have a tap that is connected to municipal water supplies that then you turn on to fill your storage unit, that you have to do manually, it's not on top of your house, you might interpret that question very, very differently. So first of all, establishing that what you are asking and what they are answering is the same question. And then similarly, the idea of intermittency generally, we were discussing how for the question around interruptions, if you are used to having intermittencies, you get it, 2 hours in the morning, 2 hours in the evening, or 2 hours every 3 days, you might not describe that as an intermittency, because again, you have the predictability factor, it's coming when you expect it to come, you are planning accordingly, whether through its multiple water source use and you go elsewhere for non-drinking waters and things like that, but either way, just making sure that they know that what you're asking is like, are you getting it all the time, and not just about like, not imposing our terminology on other people who have different lived experience that doesn't align with that terminology, and doing whatever cognitive interviewing or formative research is necessary to make that happen in the communities we're collecting these data in.
Awesome, thank you. All right, then, did you want to add something?
Only one point. I think this IW is different for different class of people actually. If it is a low income settlement, actually for them it is very different compared to the next level, mid level and the high level, because most of the time from India what I am talking is every house has a different source of water supply. People are not dependent only on the piped water supply. There is a bore well, there is a tankers and all those things. So the definition varies actually from type of class.
So what we're getting is, there's not going to be a universal, but this is great, but this is what you should think about before you do it, which is great. All right, this group in here.
Well, we were talking about when it comes to like the questions. So we discussed about recency bias. So for example, when you have a survey and you say like, in the past 3 months, you know, how much time have you had like water issue, or how much water are you having? So I think one of us was mentioning that in that situation, from experience, people would tend to like give you information based on something that actually happened more recently. So maybe 3 months is kind of like a long time to decide to like get some data. Also on that, we had a framing of question where in how many months did these happen, or at least once? And then when you try to answer your question, you know, some, in most, I don't know what specific, what was the time?
Well, I don't think we were recommending that.
We're just talking about different
We were just talking about different types of surveys and what they have used in the past.
Yeah. And also, we had a hot take. I don't know if it's a hot take, really. Yeah, it was like, I think it prefers predictability more than intermittency. I think it feels like predictability is more important than intermittency, which is like, would you prefer to have 6 to 8 hours a day of unpredictable water, or would you prefer to have 2 hours per day of predictable supply of water? So I think another person in that group also mentioned that, you know, it depends, because at some point you get to a break point where you just prefer one over the other. So that's kind of thing we're discussing.
Great, thank you. All right, and our last group over here.
Yeah, I think we had a lot of really good discussions about the questions. I think we noticed that they mainly focused on things like, obviously, like the frequency, timing, and predictability, but not necessarily making a distinction between drinking water and water for other uses, or much of an attempt to collect data on how people are using water that comes from their tap. So, you know, we talked about how in different settings there might be really complex professionalized systems for drinking water, like getting it in tanker trucks or sachets or something else that's, you know, perfectly acceptable or fine, and that's what they use for drinking water, but they might rely on piped water for things like bathing or cooking. And in that instance, maybe interruptions would be best kind of measured, or like satisfaction with that, not in terms of days without service, but the timing of when they are receiving service. So if it's before or after work, when they would most likely do those activities, as opposed to receiving water between like 12 and 2 p.m. when people aren't bathing or cooking. So we talked a lot about like making, or I guess showcasing those nuances through survey questions, and talking to households in terms of their satisfaction with their service. We'll talk a lot about like the quality of coping mechanisms, right? Or like what I just said, if you have an intermittent system. So like, I manage a project in the West Bank, Dan manages a project in Haiti, like 2 really different environments where your availability of alternative sources that are safe, reliable, affordable, predictable, are incredibly different, and that influences how customers interact with utilities, and accordingly how utilities will respond in terms of, and the stakes are just much higher. So like like I said, you could have an intermittent system where it's just more convenient to receive water at a certain time, but not necessarily life or death, whereas in other cases, that's not the case. It's a much higher stake situation. So I guess just putting that, reflecting that in our surveys. And then the last thing about utilities is just noticing that it's also about kind of continuity of service, but it might be useful to put indicators for like the HR element of that. It's a pretty radical change to go from intermittent to continuous service, and if they have the capabilities, the technical ability, the financing, or the hardware to kind of sustain a continuous system, and if they're prepared to make that shift and what help they would need with that. And then the last thing we talked about is like for professional settings like hospitals or schools, or even households, like there might be a situation where the intermittency isn't because of the municipal water supplies, but other factors. So you could have a system that you can receive water from the municipality, but you need electricity to operate it, or to push water up, right? Like up to the second floor. And so like, is your system truly intermittent if you are receiving water, but you don't have an environment that can facilitate that to use? And so putting that in question as well. Sorry.
Great, thank you. Thank you so much, everyone, first of all, for participating and being a part. If you want to keep talking, all right, two things before I get into what's on the slide. This is actually, this is things that all of us that have presented today and many others in the room are talking about and thinking about. So if you might like to continue the conversation of like writing or being engaged, we have a sheet up here to just put your name and email if you would like to stay in touch about this. And also tonight, I'm going to let David do a plug for a game. Can you tell us a brief preview of this?
Sure. You put your water utility manager hat on and ration supply to different neighborhoods to try and maximize your equity-based intermittent supply score. It's a collaborative board game my research group built. If you've played the game Pandemic, it has some similar mechanics. You're on a team. I have got lots of copies of the board game, so if you all came to the pub, we could all still play. The winning team gets to take home their board game, and you'll have fun thinking about both the hydraulics and the equity of intermittent supply.
So if you want to join us for this board game or continuing the conversation, we'll be hanging out at the Carolina Brewery tonight from 6:15 p.m. Come on by and try to play your luck and win or collaboratively win. Yes, game. So thank you all so much for all of this, and
sign up on the site.
Yes, and sign up on the sheet up here. Great, thank you.
Have a variation of the game where you're trying to maximize revenue.